when I started in the industry, patients, if we're talking about neuromodulator, patients would come in and say, freeze me. And we'd say, do you want to be frozen? It's so funny, like even the verbiage around the treatment was so unnatural. And also they were elective treatments, or they are elective treatments. So when patients were requesting something, we felt as an aesthetic provider, we had to deliver it because they were paying for it. Also, patients aren't necessarily sick, so they're strong. Some of these women, they come in and they definitely know what they want. And so you're like, I better give it to them, even if it's not the right thing. Like some patients come in with a request, but it's not what the face needs. So it took me a long time to build my consultation and find ways to talk to these women that were older than me at the time, more successful, more smart, more demanding in a way. It took me a long time to work out how to talk to them, to say, hey, listen, I hear you, I hear what you're asking for, but would you like my professional opinion? And people weren't doing that in the day. We were just giving them whatever they wanted. So it took me years to work it out. I wish someone had taught me it, but now I'm able to share what I've learned throughout the years to others to help them better with the consultation. Because when you form a very good consultation with a trusting relationship, the patients are yours forever. They don't go anywhere else. So I think that's number one. We just sort of touched on the way that you look, the way that you appear, the philosophy that you share with your patients, the gratitude for choosing you because they can go anywhere. And that trusting relationship starts with authenticity. It starts with listening. I really, really listen to my patients, and all my appointments are 1 hour. So I take the time. I could move through the treatments quicker if I wanted to, but I actually enjoy hearing about people's lives. And I find out what the emotional driver is that's making them seek a treatment. And that could be something as, their husband's 10 years younger than them, and they've been mistaken for, his mother. It may be a divorce. It may be losing your job and going back out into the workforce and having to compete against a younger, smarter, quicker generation. So finding out what that emotional driver to me is really important. I'm not a therapist. We're not therapists, but it's a big part of our job. Without the training, we do a lot of active listening. And then just using photographs that we've taken, simply with their hair pulled back, their earrings off, all the different profiles, and just really using kind language to discuss the opportunities for treatment should they want to do it. And also talking about the rare risks involved and the more common risks of bruising and swelling when it comes to facial fillers. So I take my time with that consultation and really set up a trusting platform. I also talk about the products that I use and the importance of reversibility with the hyaluronic acids. But there's other opportunities as well with other products that I'm familiar with, but at this time I don't choose to treat. But I'm going to have to get back on the bandwagon soon because, you just have to. You got to move with the times. But I don't hesitate in referring out either. I don't hesitate in telling my patients the areas that I don't choose to treat with fillers because of the higher risk for blindness. So I have those conversations now that are very easy for me that I didn't even know about, 18 years ago. So my consultations just got better by being honest and having more fruit to share. And also I take every opportunity. When a patient sits in my chair, I'm always very grateful that they took the time to make an appointment with me. And I thank them for that. But I really listen to how their other treatments were, what was their experience, or why have they waited so long before having a treatment, or are they still just considering it and it's totally okay just to have a conversation today? And every patient in your chair is an opportunity to learn from. And having that longer appointment time, I just get to learn so much from my patients. And at the same time, I've just trained my eye to actively listen, but also I'm assessing their face the whole time while they're talking with me. And I enjoy that. Like, I think of myself as a little detective, face detective, and I just work out all those little nuances in their beautiful faces, those little asymmetries, those little quirks that we want to keep there because it gives them just a unique look. And I really fall in love with that process. Like, I really, really enjoy it. And it's not necessarily something that I can teach, but I do ask people and I talk to my peers about really like love on it and enjoy it and work it all out, work out why they've got a face presentation like this. You know, you have to kind of delve and look inside their mouth, lift up their chin, palpate their bone structure, palpate the muscle activity, feel the foramens, the pulses. Like, to me, it's just like, I love talking about it. It's just exciting, you know? So I just fall in love with the faces. I fall in love with the patient stories. I love the emotional driver. And the injecting comes secondary, you know, for me.
Yeah, you definitely have a charismatic personality that just pulls people in and you immediately trust you. Something you said about how whenever they would say, "Oh, I want to be frozen," or whatever the request was, and then you say, "Well, would you like my professional opinion?" Usually, does that let them see things through your eyes or?
Yes, it does. So, you know, we have to be a chameleon and we have to be able to change our consultation to the patient's personality. So you're going to have personalities that are strong-willed, know-it-alls, you know, and that might be a personality where you're having to sort of fluff your feathers up a little bit more and say, hey, this is medicine. I'm a professional. This is my professional opinion. Would you like some extra articles to read? You know, there's those types of patients. Then there's the patient that's a little nervous and they're like not sure. And you have to, again, cater to their personality by saying, hey, let's just have a conversation today. I don't want you to feel like you have to have a treatment today. This is just an exchange of information. I want you to feel comfortable when you're ready in your time. So that's what's nice about the day, really, seeing all these different patients, seeing all these different personalities and catering to them in the best way that they understand. So sometimes I'm like big and large and putting them in their place. And other times I'm small and quiet and gentle. It's hard to get that if someone's shadowing you. You know what I mean? Like, the real raw times with your patients is where it's very personal. It's an exchange between the two of you. So it's not very often now that I have someone shadow me because I don't get all the necessity things that I like to get, like the emotional driver with another pair of eyes in the room. You know, prior to the pandemic, I used to just let people come and shadow me because, to be honest, I'd be learning from them, they'd be learning from me. And we went into a pandemic and things just changed. And I noticed that I was just getting so much more from the patients that fills my cup and fills theirs.